Just meet the side.
Idea is to inject between rectus abdominis and the posterior rectus sheath. This, are you ready with the blocks?
Yes, sir, we are ready with the next block.
Follow, okay. Please go ahead.
Okay, so this is a 76-year-old female with left intertrochanteric fracture, and she's posted for PFN. So Shishir sir will be demonstrating the SciFi and LFCN block, and he'll also show us the femoral nerve block.
Hello, good morning everyone. I'm Dr.
Good morning,
Shishir
Shishir.
and I want to show you fascia iliaca block. It is suprainguinal fascia iliaca block. The whole idea of this block uh, to anesthetize articular branches of the femoral nerve as well as lateral cutaneous nerve of the thigh. Only in very few patients we will be able to block only the obturator nerve. So for this purpose, I have chosen the high frequency probe, and you can see now I am scanning, and you will be able to see this. This is the anterior suprachiasmatic spine. So the whole idea, lot many people they try to search for the abdominal muscles, bow tie appearance, the sartorius muscle. This is the sartorius muscle. This is the abdominal muscles. Lot many people they consume lot of time uh, to localize these muscles. But the whole idea of this muscle is to see the iliacus muscle. We have to deposit local anesthesia drug between the fascia iliaca and the iliacus muscle. You can see here, this is the iliacus fascia iliaca, and going down, go down. You can see this is the circumflex iliac artery, and down below this is the iliacus muscle. You can see, and just above the iliacus bone, you can see here. So down here, you can see this is this sartorius muscle, and above these are the all abdominal muscles. So slight healing maneuver is required. You can see here slight healing maneuver is required. So you can see the cephaloid part of the probe is slightly pressed to lateralize the muscles, these muscles, and now I am inserting from caudal to cephaloid. So you can see my tip of the needle, you will be able to see. Nine. Yes. Remove कर दो ये. So you can see muscles is unzipping from the fascia. Sorry. Okay.
So could you appreciate the slight bit was intramuscular? He's trying to locate.
नहीं ठीक है.
The idea is to deposit the drug between the epimysium of the iliacus muscle and the fascia iliaca. But beneath the fascia iliaca.
Now you can appreciate.
Shishir, don't you feel we are little intramuscular?
No, no.
Okay.
See, this is the fascia. This is the fascia. हटा दो इसको, एरो हटाओ. You can see.
So
ठीक है
this is a volume block. We have to inject 40 mLs of the drug. This is the ventral approach to psoas compartment, where we hope to target femoral nerve, obturator, and LFC.
Slide
But
over.
whether in reality we target obturator is a question matter of debate, which we'll be discussing in the afternoon sessions.
दो okay. Yes, it's okay. ठीक है दे दो.
So Shishi sir is hydrodissecting the pain between the epimysium of the iliacus muscle and the fascia.
You can see.
After hydrodissection, sir will place the drug so that the pulsatility that we are seeing of the deep circumflex iliac artery, so the iliac artery, the deep circumflex iliac artery will lift off from the fascia iliaca.
Okay.
Deep circumflex iliac artery is present above the fascia iliaca,
Did-
not beneath the fascia iliaca. So if the drug is deposited beneath the fascia iliaca, the artery will lift off, and it's a very good sign that we are in the right plane. So
So now you can see there is a gap between the fascia and the muscle, and my needle is in this plane, and I am again negotiating my needle and moving forward, creating more space. This how much volume you have given? 30 ml is given. Okay, that's okay. So you can see. You can see. There is a. You can see drug spread here. The arrow is showing, pointing out the drug spread. You can see.
yes, sir. The drug spread, sir.
You can see here.
Yes, sir.
So usually people try to identify this abdominal muscles and this sartorius, but I usually focus only on the iliacus muscle. So try to identify this iliacus muscle which lies just above the iliacus muscle, and try to unzip this fascia between the fascia iliaca with this iliacus muscle. So usually I give 30 to 40 ml of the local anesthetic, and usually this is on arrival block, and can be given even in without getting any investigation of the patient, even in the emergency room, before any pre-anesthetic checkup or before any investigation we can give this block, because this block is considered as the superficial block. So can be given in those patients who are on anticoagulant as well. So now coming to the lateral quadrant nerve of thigh, you can see this is the sartorius muscle. Now moving upward, and you can appreciate that is the antesuprailiac spine. Just closer, decrease depth. Decrease. This muscle is the tensor fascia lata, and this muscle is the tensor fascia lata. So just anterior border of the tensor fascia lata, you can appreciate this is lateral quadrant nerve of thigh, which lies between this sartorius and tensor fascia lata, just below the fascia iliaca. Here you can see it is just closer to the fascia iliaca. That's all.
Yes,
That's
sir.
all.
We can very well appreciate the LFCN now. Thank you very much, sir.
Okay, so,
So-
carrying back,
Devesh,
yeah, thank you.
so
very
my
much,
block is
Dr.
over.
Okay, sir.
Moving for the next block. Which block?